What is macular degeneration? Hi, I'm Mira, Dr. Neil's assistant at Anaheim Eye Institute, and I wanted to take a moment to review with you an important condition that affects every patient with age. This is called macular degeneration. Macular degeneration, also called age-related macular degeneration or AMD, is one of the most common causes of vision loss in adults over the age of 50. To understand macular degeneration, it helps to understand how the eye works. The retina is the light-sensitive tissue lining the back of the eye. At the very center of the retina is a small area called the macula. Although the macula is only a tiny part of the retina, it is responsible for most of your sharp, detailed central vision. The macula contains millions of specialized light-sensing cells called photoreceptors. These cells capture light entering the eye and send signals to the brain, allowing you to see fine details. Macular degeneration is a disease that gradually damages these photoreceptors and the supporting cells beneath them. As these cells become damaged and die, the macula can no longer function properly, causing the gradual loss of central vision. You rely on your macula every day to read, drive, recognize faces, watch television, use your phone, and see fine details. As more of these cells are lost, your central vision becomes increasingly blurred or distorted, while your peripheral or side vision usually remains intact. What causes macular degeneration? The exact cause of macular degeneration is not completely understood, but it is primarily related to aging. Over time, the cells of the macula gradually wear out and become less able to function normally. Several factors can increase your risk of developing macular degeneration. These include getting older, having a family history of the disease, smoking, high blood pressure, obesity, prolonged exposure to ultraviolet light, and eating a diet low in fruits and leafy green vegetables. One of the earliest signs of macular degeneration is the appearance of tiny yellow deposits beneath the retina called drusen. At first, these deposits may have little or no effect on your vision. In fact, many patients don't notice any symptoms at all. But over time, as more drusen develop and grow larger, they begin to interfere with the health of the macula, the part of the retina responsible for your sharp, detailed central vision. As the disease progresses, the delicate light-sensing cells in the macula become damaged and gradually die. Because these cells cannot regenerate, the loss of vision becomes permanent. Patients often notice that words become harder to read, straight lines may appear wavy, faces become more difficult to recognize, and fine details gradually disappear. One important thing to understand is that macular degeneration usually affects central vision, while side or peripheral vision often remains normal. This means that although complete blindness is very uncommon, everyday activities like reading, driving, recognizing loved ones, or enjoying hobbies can become increasingly difficult without treatment. Macular degeneration is generally divided into two forms: dry macular degeneration and wet macular degeneration. The good news is that about 90% of patients have the dry form, which usually develops slowly over many years. The remaining 10% of patients develop the wet form, which is less common but much more aggressive. Although both conditions affect the macula and can lead to vision loss, they develop in very different ways and require different treatments. Understanding which type you have is one of the most important steps in protecting your vision. In the next few minutes, I'll explain the differences between dry and wet macular degeneration, how each one affects your eyesight, and the treatment options available for both. Let's begin with dry macular degeneration, the most common form of the disease. About 9 out of every 10 people with macular degeneration have this type. Dry macular degeneration develops slowly over many years. As drusen gradually build up beneath the retina, they interfere with the normal function of the macula. Over time, the light-sensing cells that provide your sharp central vision become less healthy. Some of these cells eventually stop working and die. Because these cells cannot regenerate, the damage is permanent. Fortunately, the progression is usually gradual, allowing us to monitor the disease closely and intervene when appropriate. In its earliest stages, many patients notice little or no change in their vision. As the disease advances, reading may become more difficult, faces may appear less distinct, and fine details can become harder to see. Even though central vision becomes affected, side or peripheral, vision usually remains normal. Regular eye examinations are especially important because dry macular degeneration can progress silently for years before noticeable symptoms develop. The earlier we detect changes, the better we can monitor your eyes and recommend treatments or lifestyle changes that may help preserve your vision. Although only about 1 in 10 patients with macular degeneration develop the wet form, it is responsible for the majority of severe vision loss caused by this disease. Wet macular degeneration occurs when abnormal blood vessels begin growing beneath the macula. These blood vessels are fragile and unhealthy. They can leak fluid, bleed, or leave scar tissue behind, damaging the delicate cells responsible for central vision. Unlike dry macular degeneration, which usually develops gradually over many years, wet macular degeneration can progress very quickly, sometimes over just days or weeks. Patients may suddenly notice that straight lines appear bent or wavy, objects look distorted, or a dark or blurry spot develops in the center of their vision. If you ever experience these symptoms, it's important to contact your eye doctor immediately. The good news is that today's treatments have dramatically changed what we can do for patients with wet macular degeneration. When diagnosed early, we can often stop the disease from progressing and, in many cases, even improve vision. That's why early detection and prompt treatment are so important. Although we cannot yet cure dry macular degeneration or restore retinal cells that have already been lost, there is a great deal we can do to help protect your vision and slow the progression of the disease. The first step is regular monitoring. By examining your retina and performing advanced imaging, such as OCT scans, we can detect subtle changes long before they noticeably affect your vision. For many patients with intermediate dry macular degeneration, specialized nutritional supplements known as ARDs, 2 vitamins have been shown to reduce the risk of progressing to advanced disease. A healthy lifestyle is also important. Not smoking, maintaining good blood pressure, eating a diet rich in leafy green vegetables and fish, exercising regularly, and protecting your eyes from excessive sunlight can all help support long-term retinal health. For patients who develop geographic atrophy, the advanced stage of dry macular degeneration, we now have an exciting treatment option called Syfovre. Syfovre is administered as a small injection into the eye and works by slowing the process that causes retinal cells to deteriorate. While it cannot restore vision that has already been lost, it can slow the progression of geographic atrophy, helping preserve healthy retinal tissue and maintain useful vision for a longer period of time. Clinical studies have shown that Syfovre can slow the growth of geographic atrophy by approximately 20 to 30%, making it one of the most significant advances in the treatment of dry macular degeneration in many years. Treatment is typically given every month or every other month, depending on your individual condition and treatment plan. Not every patient with dry macular degeneration is a candidate for Syfovre, but for patients with geographic atrophy, it offers new hope where previously there were very few treatment options. As research continues to advance, we remain committed to bringing our patients the latest proven therapies to help preserve vision for as long as possible. Although wet macular degeneration can cause vision loss very quickly, today's treatments have completely transformed the outlook for many patients. The goal of treatment is to stop the abnormal blood vessels from leaking, reduce swelling in the retina, and preserve as much vision as possible. The most effective treatment is a series of medications called anti-VEGF injections. These medications are placed directly into the eye, allowing them to reach the retina where they are needed most. They work by blocking the signals that cause abnormal blood vessels to grow and leak. As the leakage decreases, the retina often becomes healthier, swelling improves, and vision can stabilize. In many patients, treatment not only prevents further vision loss, but can actually improve vision that has already been affected. The injection itself is much easier than most people expect. Before the procedure, your eye is completely numbed with anesthetic drops so that you remain comfortable throughout the treatment. The injection takes only a few seconds, and most patients describe feeling little more than slight pressure. The entire visit usually takes only a few minutes, and patients are able to return home shortly afterward. Because wet macular degeneration is a chronic condition, treatment usually involves a series of injections over time. Regular monitoring with OCT scans allows us to determine exactly when additional treatment is needed. With early diagnosis, consistent follow-up, and modern medications, many patients are able to maintain useful vision for years and continue enjoying the activities they love. Being diagnosed with macular degeneration can feel overwhelming, but there has never been a more hopeful time for patients living with this disease. Today's advanced imaging allows us to detect macular degeneration earlier than ever before. New treatments can slow its progression, preserve vision, and in many cases, help patients maintain their independence and quality of life. The most important step is not waiting. Regular eye examinations and early treatment give us the greatest opportunity to protect your vision. If you've noticed blurred or distorted central vision, difficulty reading, or changes in your eyesight, don't ignore these symptoms. Schedule a comprehensive retinal evaluation as soon as possible. At Anaheim Eye Institute, we're committed to combining the latest technology with compassionate, personalized care to help you preserve your vision for years to come. Thank you for taking the time to learn about macular degeneration. We look forward to helping you protect one of your most precious gifts, your sight.